I owe my life to the NHS. I've had 2 life-saving surgeries in my life, and I'm so grateful to the NHS that I wanted to give something back and to contribute to patient care for others and improved outcomes. Having been born without an oesophagus, I still live a meaningful life now because I've had 2 surgeries. I've had colon reconstructed to be my makeshift oesophagus, and it's held up for over 50 years now, and I continue to lead a good life. I'm very grateful. I was listening to the news one evening, and the local news had an article about this study that's supporting children with ADHD with their sleep. My daughter is ADHD, and she's always struggled with her sleep. I've had many troubles trying to get her to bed, and it was really great to hear that people were acknowledging that this is a problem for children with ADHD. I was brought into studies relating to perioperative care for people having major operations. So it was really useful to feel that, it made me feel very useful to actually use my experience to inform better experiences for other patients going through big surgery. Since getting involved with the Wessex SDE as a digital critical friend, I've now been asked to be a member of DAC, the Digital Access Committee. So as a member of the public, I'll be looking at research projects that want to use the public's data for their research. And I will have a say in whether they have access to that data or not. I think it's really important that we don't leave that to the professionals. We need members of the public saying, I'm happy for the research to have this data, I think that's fair. Or we can say, I'm not comfortable with this, it doesn't sound like something that's really going to benefit the public, and our voice will be heard when those decisions are made. And I think that is really important work that needs to be contributed to by the public. Getting involved in PPI makes me feel that I'm not just sitting around worthless, that I'm actually able to contribute. It's very accessible to get involved in projects when you're unable to work, but you can actually feel doing this is doing something useful, but it's not the same as working. It's very accessible. It's often an hour or 2 here or there that you can do from home on Zoom. So you can get involved in these projects but not feel that it's too much for you if you have your own health issues. When I first got involved, I was quite cynical, and I kind of felt that research was obligated to include patients, and it was a kind of tick box thing that, oh, we've said we've talked to patients, and then that's kind of, we've done our bit by talking to them. I was really a bit mean about how that would be done. Now I'm involved, I understand that these studies really engage patients in a meaningful way. If you're researching something but you've got no personal experience, you really need to understand the patient perspective to improve your study and to get the best out of your research.